Joining us today. Okay, welcome everyone. Again, it's great to have everyone joining us today. We're looking forward to a great information session and talking about everything. So welcome. Let us know where you're joining from. I will put where I am. I am Rocky Hill, Connecticut. Great, I see a lot from Fairfield, Connecticut. That's great. I see Hamden. Thank you, Esther. We're happy to be here. Groton, yes, this is great. Maine, this is fantastic.
Wow. I got two territories here, Maisie, West Hartford and New Britain.
Okay, great. Michigan, wow. Again, if you're just joining, I just want to say welcome and welcome. And we will start shortly. See, Florence is getting some hellos. That's nice. Yeah. Greater Hartford, great. So we will start in another minute, giving chances for more to join us. Just put in the chat where you're joining us from. Okay, welcome everyone. Very excited that you are here with us today. I see from Texas, Bloomfield, yeah. All over Connecticut, Detroit, Michigan. Great. Again, welcome everyone. We will start shortly, in about a minute. Okay, it's 11:32, so I am going to kick this off. I said welcome a few times, so that's great. Happy to have everyone with us today. We have an awesome program for you today on the Black caregiving experience. My name is Maisie Russell. I am a member of the Connecticut Chapter Board of Directors and chair of D&I Community Chapter and an advocate. My why for being here today, my mother, my loving mother, passed from this disease in 2015. She was a dynamic leader, a visionary, a strategic thinker, and many more attributes. My family and I leaned into the disease and secured what I call an A+ care for her for 15 years. I did extensive research on the disease. I contacted the Alzheimer's Association, the Connecticut chapter, for direction and support. I took the knowledge I gained and kept my mother in my home for 98% of those years with exceptional care and support. My passion is for the members in my community to duplicate what I did and many more. Today, we will hear about caregiving in the Black community and also the latest research. Note, Black African Americans are twice as likely to be diagnosed with Alzheimer's, yet less likely to seek support. A part of the program today will also include Q&A. My co-host today is Jonah Francis, also a member of the Connecticut Chapter Board of Advisors, a support group leader, and an advocate. I'll turn it over to Jonah to say some words about himself.
Thank you, Miss Maisie. I appreciate it and love your why as well. So my why is twofold. As Miss Maisie said, I do sit on the board as well as she does as well. And I do hold a men's only dementia caregiver support group. And when I say my why is twofold, is personally, in my family, we did have my father's mom that was diagnosed with dementia back in 2011. And unfortunately, coming from Jamaica and spending majority of her life there, the stigma, the stereotype is a lot different than what we experience here in America, even though we still have a ways to go. So that's the personal side of things for me. The professional side of things is I do own a home care agency. It's a family-owned business. And we've been in this business now for just about 10 years this September. And almost 85% of our census is clients and families that are affected by their loved ones living with dementia, Alzheimer's, and other form of dementia. So for me, being hit from both sides of things, I joined the association as a volunteer in 2019 to learn as much as possible to be able to help the families that we are responsible for caring for, while at the same time to try and bring an end to this. And I'm so glad that we're in the era of treatment, as we learned in the summit about a month ago, right? And without further ado, I think that's a really good transition to bring in Kristen Casado, who's going to give us a brief overview of the research funded by the Alzheimer's Association. Kristen is the Director of Communications for the Alzheimer's Association, the Connecticut chapter, and a research champion for New England. Kristen?
Thank you very much, Jonah. I'm going to share my slides. Can you guys see that in the right format? Yes, fantastic. Thank you guys all for coming, and very excited to hear from Florence Johnson about her research that she's doing into what is happening in the Black and African American caregiving space. And we'll hear about Florence and hear a little bit about her bio in just a few moments. But first, I wanted to give you guys kind of an overview of what's happening with the Alzheimer's Association in research and the reason why I got involved. My mother, who was my best friend, was diagnosed with younger onset at age 61. We do know that people have been diagnosed in their 40s and 50s, and 61 was tough for us as well. Mom only lasted with Lewy body dementia for 4 years. And in that time, we tried to make a lot of beautiful memories and spend a lot of time together. And I always say that my mom gave me my new purpose and passion in life, which is to really share the words, spread awareness, and make sure that no one ever has to say, I wish I knew about you guys when I was taking care. So let's start off with showing you the symbol. The symbol is on everything that we have, and it's people and science. It's as we are taking care of people who are dealing with this disease, people living with it, caregivers, people concerned, we're also pushing research forward, which is really, really important, and some things that I'm going to be speaking about today. I'm going to do this briefly, and then Florence is going to come on and talk about it as well. But I wanted to share with you the difference between the two terms, which you may hear interchangeably quite a bit, dementia and Alzheimer's. Dementia is the umbrella term really dealing with the symptoms that you experience, right? The forgetting, the cognitive changes that you have. I say it's a processing disease, right? So not realizing that the sock goes on before the shoe eventually, getting lost, coming back from a place where you're really familiar with, the grocery store or your home, something to that effect. So that's what dementia is. But then underneath are the different things, the biological changes in the brain that cause those symptoms. Alzheimer's is the most common type, vascular Lewy body frontotemporal, which, if you guys have been following the news, Bruce Willis, the actor Bruce Willis, was diagnosed with FTD. And so we did a bunch of stories on that and taking a look at what that means. Every March, we have something called the Facts and Figures come out. So this is 2022, but new numbers are going to be coming out in just a few weeks now, 1, 2, 3 weeks or so. And this is what I wanted to share with you about some of the stats that are really, really powerful, including more than 6 million Americans living with Alzheimer's right now, and that 1 in 3 seniors dies with Alzheimer's or another dementia. And just to share with you, here in Connecticut, there are 80,000 people living with Alzheimer's and twice as many caregivers. So what may impact your risk of cognitive decline? There's a couple of things. Age is actually our greatest risk factor. Many people who are diagnosed over the age of 65, even though I just was mentioning that a lot of people are diagnosed younger. It's called younger onset when they're diagnosed below that. There's a small genetic component, and also race and ethnicity, sex and gender. So as we mentioned, Black African Americans are 2 times more likely, Hispanic Latinos 1.5 times more likely to develop this disease, and women make up 2/3 of those with this disease. Here are some of the other things that we can control, right? We can't modify your age, your genetics, or your race, but can you modify these other things? The amount of education that you get, the cognitive and social engagement, your environmental factors. And then we'll talk about this in a moment, all those great things like the physical activity, the amount of sleep that you have, taking care of your heart, that diet, the Mediterranean diet that we'd love to talk about as well. And realizing that social determinants of health may impact some or all of these factors, in that if we talk about a fresh vegetable diet, a lot of people, as you know, live in food deserts where that is not able, they don't have the ability to get those fresh fruits and vegetables. In addition to, what if they live in a place where exercise, especially at night or before work, is not safe? So there are a lot of things, and we do need to study risk from all angles. So we are talking right now about the fact that we are the largest nonprofit funder of Alzheimer's research in the entire world. And it's really quite amazing that $310 million right now invested in 950 projects in 48 different countries. And in part, some of the money coming from research comes from donors, and we are so grateful for everyone who raises money at our different events. But also we get money from some of the federal government to go to research, not to the Alzheimer's Association, to Alzheimer's research. And that, back in the day when my mom was diagnosed, she was diagnosed in about 2009, we didn't even have a B. We didn't have $1 billion in research invested by the government. And now look at us in 2023, we are up to about $4 billion. So it's really, really exciting. And in part, it's because of advocates, and advocates share their story, so that when you get to the place where a legislator or a lawmaker is on the floor making a vote, they'll remember, oh, that story Jonah Francis told me about his grandmother not able to receive care. I remember that, and now I will vote yes for additional money or for additional care for folks. Here in Connecticut, good news that a lot of research money comes right here. We have a lot of active, great research going on at places like UConn Health, Yale, up at Storrs in UConn, and really interesting studies that range from the impact of alcohol on your dementia risk, the impact of depression, what are really rare forms of dementia, what's the difference between the male and female brain, and even what's happening in the ER. So there's a lot of research that goes into what's happening with the caregivers in the ER. Are they being given what they need? Are the resources available to them when they take their loved one home? So lots of fascinating research. And all this research, not only goes to looking at things like caregiving and looking at things, if we talked about some of the risk factors, but also about medications. And just to share with you, we've had some really great breakthroughs the last few years. And if you can see, starting in the very beginning, there were not any medications that did anything to affect the course of the disease. But yet, up until 2014, these medications really helped with some of the symptoms that people have, until 2021, when a drug called aducanumab, now Aduhelm, was approved by the FDA. That was approved by the FDA, not easily accessible, readily accessible to folks due to many things, including price and including not coverage by Medicaid and Medicare, which is an entirely different webinar, ladies and gentlemen. And now we fast forward to 2023, where another medication has been approved by the FDA, but still not covered by insurance. We, as an advocacy organization, are working on that to make sure that everyone who qualifies is able to get it. So we've got aducanumab, lecanemab. Another under FDA review is donanemab. This is changing the course of the disease. These medications actually go in and kind of get rid of some of the plaques, which is a hallmark of Alzheimer's disease, and also help give families more time with their loved ones, okay? So we're talking about that, but there are also a lot of different things we're looking at: neuroinflammation, cellular communication, bioenergetic. There's a lot of different things that we are researching as the Alzheimer's Association. And we have found, actually, which is really quite fascinating, that there can be changes happening in your brain up to 20 years before any symptoms occur. 20 years. So what does that mean? That means there are things we can do now to reduce our risk. And in fact, if we follow a number of them, we could potentially reduce our risk by 40%. What are those things? Some of the things we talked about already. Physical activity, lots of research about exercising several times a week, getting that heart rate up, healthy diet, as much the Mediterranean diet you can, reducing other sorts of foods that are not good for you, which we'll talk about in a moment. Cognitive and social stimulation, which was so hard to do during COVID, right? So challenging, but making sure you're engaged in conversation and you're staying social. Here's one of the things I was talking about that food. We have this really big, wonderful science conference every year. And it's called AAIC, Alzheimer's Association International Conference. And last year it came out with this really interesting study about ultra-processed food and your dementia risk. So this is what it said. If 20% of your diet is made up of processed food, it's going to lead to about a 30% faster decline in cognition. Okay, so what does that mean? That means, unfortunately, your fast food, your frozen pizza, which I'm sad about because I love frozen pizza. I love it. It's always in the freezer waiting for you, like a good friend. Your frozen pizza, your cereals, your soda. So if we could reduce everything in moderation, right? If we could reduce some of that, it's never too late to incorporate some helpful actions into it so we can try to reduce our risk of this disease. Know that every study helps scientists learn more about what we're finding out. And we also absolutely know that there's an urgent need to include people of all races, of all underrepresented backgrounds in clinical trials, because there's something, for an example, we have something called the IDEAS study, and that looked at the benefits of someone getting a PET scan, which is a more involved MRI, right? It shows different pictures of the brain. And the study was shown that it helped folks and helped the doctors kind of understand and help better communicate. However, the numbers of those in the underrepresented communities who are involved in this trial was very low. So now there's something called New Ideas, where 4,000 of the 7,000 people who are involved are going to be of underrepresented communities. So there is absolutely an effort to continue that in clinical trials. Just want to share with you, we have our website that's and it has all sorts of information for you. If you want to know more about our research, alz.org/research. If you have room on your phone for another app, the Science Hub app, you can go on there, find out who we're funding, what's going on, all sorts of new articles. And also we would love for you to get involved and check out Trial Match, alz.org/trial match. It's where you put in your information and you're matched with clinical trials that you could qualify for and that could be in your area. So check it out. Some of them are as easy as filling out a few questionnaires a couple times a year. So check that out. And of course, 24/7, we have our 24/7 helpline, 800-272-3900, which is really available for anybody with any questions about anything at any time. So that is that for me, for my presentation. And now I would like to send it over to Maisie. I believe that what we're going to do, Maisie, we're going to have some of the questions and save them to the end so that some of the things about me, I talked about, and then of course, some of the things that Florence is about to speak about. And so let me send it back to you, Maisie. Thank you so much.
Oh, you're welcome. Thank you, Kristen. That was awesome. I even took a few quick little bullets for myself while you were talking about it. So I'm sure others are doing the same. Great information. So of course, save your questions. We want you to have questions at the very end. So now I will introduce Florence, Miss Florence Johnson. She is an RN, MSN, MHA, CD, and is a third-year PhD candidate at the University of Michigan School of Nursing. Her research examines the relationship between community support services used and mental health in the Black family caregivers of people living with dementia in the community. Florence Johnson is a registered nurse with over 30 years of experience in many healthcare settings on the continuum. Ms. Johnson served on the board of directors for the North Central Area Agency and Agent. She was a member of the Connecticut Alzheimer's Association Annual Education Conference Committee and Women's Champion. She is the immediate past president of the Northern Connecticut Black Nurses Association. She has presented her research at the Alzheimer's Association International Conference. If there's anything else that you would like highlight, Ms. Johnson, please do so, but I cannot wait to hear what you have to share with us today. So we welcome you.
Thank you so much, Ms. Maisie. It's great to be here to share my work with everyone and to let you know how passionate I am about dementia and dementia caregiving. As Kristen mentioned about the AAIC, the international conference, I am so passionate about this work that I actually, as a student, joined the ISTART, which is the International Society to Advance Alzheimer's Research and Treatment. I had the opportunity last year to meet with physicians and scientists doing the brain work along how to look for cures for dementia. Of course, being a caregiver advocate myself, I kept saying, when are we going to have a path that talks about dementia caregiving? So I'm hoping that this summer we'll have that. So right now, I will share my screen and start the conversation. Are you able to see my screen?
Yes.
Okay. So again, thank you for inviting me to talk about my work. I'm very excited to be here with everyone. As Kristen mentioned, I just wanted to again talk about dementia and how as lay people, we talk about dementia and Alzheimer's as the same term and use it in the same terminology, but it's not. So dementia is the big umbrella, and then we have the different types of dementia, with Alzheimer's disease being the one that most people know about. So this is very personal for me, and in my line of work, I've advocated for other families and other residents, patients, clients, because I've worked in home health, I've worked in hospitals, nursing homes, and just looking at quality of life for our older adults in general. To the left, you see my mother-in-law, who's holding one of my twin little babies. She took care of her sister-in-law, who at the time, we didn't have a diagnosis, we didn't have a terminology for it, but everyone in the family would just say Aunt Bert is kind of out of her mind today. But now that I look back to the 1980s, she really did have some cognitive impairment and probably dementia. She never got a real diagnosis. Her brother, who was married to my mother-in-law here, promised her, because she was never married and didn't have kids, that he would never put her in a nursing home. But he wasn't the one that provided the care. My mother-in-law did. She would take care of Aunt Bert during the day and then go to work in a hospital, second shift, and come home and do it all over again. And this went on for over 5 years until Aunt Bert died at home. On the right is my brother. His name is Kenneth. He lives in the Netherlands. He was a nurse, is a nurse. As Kristen talked about, he and I would talk every day at some point of the day. So I could he would share stories with me about not being able to get back home at night, forgetting how to get home, forgetting that he had stuff cooking on the stove, actually had the fire department at his home one day. So along with his daughter, I was able to, from here, advocate for him to get tested. He finally was diagnosed with dementia about a year ago. And where you see him standing here is the door to his room in the facility that they basically had to be creative on how to get him into the facility. So he he thought that he was going to work at this new place and has settled in nicely. But just with the communication, I can definitely see that his disease is progressing. So when I talk about caregiving and dementia, trust me that it's very close to my heart. And most of us that do this work do it because it's close to our hearts. Just a little bit of data, because Kristen did an absolute fabulous job of sharing that information. Just know that family caregiving is difficult, but dementia family caregiving is 2-3 times as difficult. You don't get time off. It's 24/7. So as you can see, the number of caregivers are increasing according to the National Alliance for Caregiving. In 2020, the number of unpaid caregivers rose from 43.5 million to 53 million. 61% of them are female and 61% still work while providing care. Caregiving can have positive benefits such as improved relationships, but it can also create physical and mental illnesses. Nationally, 6 million people are living with dementia, and we have about 11 million caregivers, which averages to about 2 people per person. As noted before, African Americans are twice as likely to report, twice as likely to get dementia, but African Americans are also twice as likely as their white counterparts to report being a caregiver to someone with dementia or Alzheimer's. They are the largest group of family caregivers for people who are living with dementia. Caregiving is a significant and should be a significant public health issue that affects millions of individuals' quality of life. It can lead to depression and fatigue. And as I mentioned in the last slide, caregiving can be emotionally and physically demanding. Over half, about 53% of caregivers indicated that a decline in their health compromises their ability to provide care. This can also affect the caregiver's sleep pattern, which makes sense. If you're not healthy yourself, it's difficult to give good care and be at your best if you're not taking care of yourself. Caregivers are increased risk of having multiple chronic diseases such as high blood pressure, diabetes, COPD, respiratory issues. It is well documented that they often neglect their own health because they are providing care to others. Our public health experts, our policymakers, health and social work providers, researchers, and healthcare and employees need to all work together to figure out how we can best support our caregivers. As noted, Black people are twice as likely to be diagnosed with dementia. However, they are diagnosed later in the disease process, which means that the care is a lot heavier. When you look at the progression of the disease, it's harder to redirect a person. It's harder to assist them. So when Black people are diagnosed later, it's harder for the caregiver or caregivers to even try to maintain this person at home. So what are some of the reasons that might delay diagnosis? From the caregiver and the person's perspective, it could be fear. They might be afraid of what the diagnosis may entail, or the implications in their future. They could be in denial. People may deny that they have any memory problems or be in denial of the severity of the condition. So they might laugh it off or be heightened when other people are in the room and make sure that they're not displaying that they have memory issues. they could also say, oh, it's just part of my old age, and just minimize the effects of it. Also, the cost of seeking diagnosis may be prohibitive, especially for those who may not have insurance, or insurance that's not enough to cover the needs. There could be a lack of access to services, because in some areas there may not be a physician that is trained in dementia and dementia care. There could be not enough access to support services. And then, as has been mentioned, there could be stigma. People may be reluctant to discuss their memory problems with others because of the stigma associated with dementia. And let me just share an experience with you all. Last year, I attended a caregiving / people living with dementia conference. And a gentleman, nicely dressed in his suit, went up to talk about his experience with being diagnosed with dementia. As a professional who was very well known and respected in his community, once he received the diagnosis for dementia, within weeks, he was let go from his position. And he found that to be quite troubling, because if someone, this is his exact words, if someone were diagnosed with cancer, the community rallies around that person and their family. And the first thing you hear is, how can we help? What can we do to support you? But compare that to dementia. He says, as soon as you get the diagnosis, everyone runs from you as if you're going to catch the dementia or the Alzheimer's. And that has always stuck with me. I thought that was such a sad story and a sad statement for where we are. So we talked about my research. I'm very committed to making sure that we support our caregivers, because when we find a cure for dementia and Alzheimer's, the people will still need someone to care for them. Caregiving is not going away. So to me, we need to support our caregivers as much as we are trying to find a cure for the disease. There has been documented disparities in supportive services to caregiving. So in examining how community support services affects mental health of Black caregivers, my hypothesis is that when caregivers are educated about support services, they will access it more. But because there's lack of knowledge, we don't access it as much as we should. And these disparities of support service use depends on the person's age, their gender, race, as we've been talking about, ethnicity, and also socioeconomic status. And these variables are present in most research work that we do. So we have to find a way to not only decrease these disparities in dementia care studies, we need to decrease them in research, period. And the way we can do this to reduce the disparities is to encourage more Black people to participate in research studies. And I understand the fears behind it, but even with this research that I'm conducting that does not include blood drawers or anyone touching people, it has been difficult to get people to commit to participating in the research. Older adults and Black people are less likely to receive support services such as home health services, respite care, and nursing home care. And that's because we don't communicate stress and the need for help. Additionally, individuals with lower socioeconomic status are more likely to experience poorer care and access to fewer support services. This is very well documented. Furthermore, research shows that women are more likely to receive support services than are men. These disparities may often be due to cultural beliefs, a lack of access to services, language barriers, a lack of knowledge even by the providers, and limited resources in general. So because this is being, the webinar is sponsored by our Connecticut folks, I have pulled up some information that's specific to Connecticut. When seeking a definitive diagnosis, it's very important to start with your primary care physician, especially as soon as you start to observe any cognitive changes. Please do not attribute any changes that you are observing to just old age. That you would not attribute high blood pressure or even symptoms of diabetes to just aging. So we have to treat cognitive changes the same way we would physical illnesses. Ask your physician for a memory clinic referral or a neurologist. You want to be sure that you are being seen by someone who specializes in memory care. It's important that the proper testing is done. One, to determine the cognitive impairment diagnosis, and two, to figure out exactly which type of dementia this person might be experiencing. Most primary caregivers, primary care providers are well-meaning, they're great, but they're not equipped to diagnose or treat dementia. So for those of you who are not in Connecticut, within the Northeast and the Midwest region of the state, I pulled up just a few memory clinics in the area. So there's some listed here for Michigan, New York, Massachusetts, and Illinois. If your state or city does not appear here, please work with your physician to find a memory clinic in your general area. So in Connecticut, we have the data on caregivers, 143,000 caregivers in Connecticut, providing 158 million hours of care for the value of $2,994, sorry. And 47% of them have reported chronic conditions. 17.16% report depression, and I'm sure even the numbers are higher than that when it comes to depression. Nationally, caregivers are the backbone of dementia care, and obviously it's no different in Connecticut based on the numbers. Support services are about helping the caregiver to reduce the stress of caregiving. Everyone appraises stress differently, so please do not compare yourself to anyone else. Some Black women feel that they must do it all without complaining, whereas white women speak quite frequently and freely of their stress and the need for help. So the Black woman syndrome is called Superwoman syndrome, where we feel like we can do it all. I got it, I can do it. Or you are the favorite for the person that you're taking care of, so they don't want anyone else doing it, and you have to carry the brunt of the caregiving. And since dementia is, so let me just talk to you a little bit about what's on the slide. I've divided support services into two different categories. On the left are support services that should not cost you anything. And on the right, those may cost a bit of money. So on the left, you can join support groups in your area. You can even develop your own. It can be in person or virtual, because we know that we're all busy these days. You can ask friends and family to help in any way that they can. They can come just sit and have coffee with you. So you can talk to somebody other than your loved one that you've been taking care of. They can come stay with your family member while you go run errands, like pick up prescriptions, some groceries, or even just have time to go get your hair done. Or to the barbershop if you're a male caregiver. There's also spiritual support. There's tons of researchers now partnering with churches to provide education, support, and also to help engage in research in the area of caregiving and dementia. And this last item is very critical, and it's mostly overlooked: dementia training. Families need to know what to expect when you're taking home your family member that has dementia. The person you take home at diagnosis is not the same person you're going to be taking care of 60 days, a year down the road. So family members need to be given training at each step of the way on what to expect and how to respond to their care, the person they're giving care to. And then on the right side is the first thing I mentioned here is respite. Respite can be in your home. It can be a place that you bring your family member to. As a home care nurse, I would say that keeping your person at home as much as possible and bringing care to them is better, because when you take a person out of their routine and their normal environment, it creates, it makes the person get more confused and can become quote unquote more combative, because now they don't understand what's going on. Who's this new person and whose house is this that you're bringing me to? Adult daycare programs are available. Some towns and cities will offer a stipend to support using adult daycare. This is an area where people can go and spend the day doing crafts, reading, playing games with their cohorts. And then palliative care, I really want to talk about this because this is an area that people don't think about, even physicians don't think about this. Since dementia is a chronic condition without a cure, palliative care is a covered item with insurance. Again, bring this up with your providers. Medicare will cover this as long as the person is homebound and doesn't drive and needs someone to take them out. So palliative care is care given to someone who has a chronic illness that will not have a cure. We expect them to slowly get worse. And then as they get worse and the care becomes heavier, you can transition to hospice if needed. But the beauty of being in palliative care is that you've now developed a relationship with those nurses and the caregivers, so that when you have to transition, they already know you. The family is within the program. You're not starting all over. Palliative care does not mean that you're expecting the person to die tomorrow. Palliative care says, we are going to help the person and their family manage as much as possible and bring in services as needed. Meals on Wheels, I think everyone knows what this is. Meals are delivered to the person so that the family doesn't have to worry about cooking. And if the person is still able to be at home by themselves, Meals on Wheels is a great benefit. It's also important when you have your person at home and you're taking care of them by yourself. Don't forget to try to engage your loved one in activities that they enjoyed before the dementia diagnosis. You want to keep them in their routine as much as possible. So if mom and dad or mom and aunt enjoyed walking, as long as it's safe, keep walking, even if it's just down the street and back. If they enjoyed going to get their hair done every week, bring them to the barber shop, the beauty shop. So as much as you keep them in their routine, the less of a struggle you will have in trying to provide care. Oh, and then another thing that you can do with them is play music and dance. Music is the equalizer for everyone. Music therapy in dementia is gold, but you have to remember to play music of their time and not of today. So as Kristen mentioned, the Alzheimer's Association is available 24/7. Again, here's the phone number for the Connecticut chapter. There are chapters in every state, every major city. When I worked in Connecticut and I would have people come to me and say, you know, I don't know where to go for help, I always send them to the Alzheimer's Association. I had an opportunity to visit our chapter here, the office in Michigan, and I walked into their library. I could not believe the amount of resources that they had in that room. I actually ended up picking up a few for myself, but there were books with tip cards in them. So please, if you need any help at all, if you're just starting the journey, reach out to your Alzheimer's Association. In addition to the Alzheimer's Association in the state of Connecticut, they also have a statewide respite program that is provided through their state unit on aging. And here is the web address to reach out to them. This program offers relief to stressed caregivers by providing information, support, and even a plan of care that can help along the care continuum. The National Family Caregiver Support Program provides a periodic break for caregivers to regroup both physically and emotionally. The funds are available via services to support family members and other unpaid caregivers caring for older individuals, grandparents, and older adults. So you can also access assistance through your local area agency on aging. Every state has one. If you have not been in touch with yours, look them up. They can be very supportive along with your Alzheimer's Association. Those are two numbers that you should keep in your pocket. So if you're one who likes to conduct your own informal research after getting the diagnosis, or you start seeing changes in your loved one, you can again access your local Alzheimer's Association, which provides information about Alzheimer's disease, dementia, related disorders, as well as support for families and caregivers. The National Institute on Aging provides research-based information about Alzheimer's and dementia, including diagnosis, treatment, caregiving, and research. They are a big funder of research. Dementia Caregiver Support is a website that provides resources, support for caregivers of those living with dementia, including tips on how to cope and manage with care. There's also the Dementia Society of America. This organization provides education and support for those living with dementia and their family and caregivers. As I've been talking about support care support systems out there. There are two branches of resources. There's the medical branch, which includes assisted living and nursing homes. What I wanted to really hit home with these two resources is that in the event that you do have to put your loved one either in assisted living or a skilled nursing facility, please do not feel defeated. Caregiving is overwhelming, and when you're doing it by yourself, it's even more overwhelming. So if you need to transition your loved one to a nursing home, look at it as an act of love, because it has to be difficult for the caregiver to be able to transition their loved one into a nursing home. But doing that allows you to now be the wife, the sister, the daughter, the son, the brother, and let somebody else take on the heavy lift of caregiving. This does not mean that you don't have anything to say or that you don't participate in care. This means that you get to come in and love on your loved one with rest and energy, but also participate, give input. And the first thing you should do if you have to transition into a nursing home is to let the staff know who your person is. This is my mom. She was a nurse. This is what she did. So that if they start to see some behaviors, they will understand where it's coming from. I'll give you an example. When I was working with a nursing home a few years ago, they had a resident in their facility. Every morning he would get behind the nurse's station and start pulling charts, and they would just shoo him away. You're not allowed back here. You're not allowed back here. When they finally spoke to the family, they found out that he was a physician, and in the morning he would make rounds. So when he woke up at the nursing home and saw all the charts behind the desk, he thought he was at the hospital to make rounds. So when you learn about when nursing homes learn about what your family member did, the hope is that they can put things in place to mitigate them reaching out or looking for things to do. So what they ended up doing at this nursing home was building charts that they left out every morning for the physician to come do his rounds. So non-medical services include such things as live-in help. These caregivers will do full care, bathing, hands-on care, cooking. But you also can have companions who basically come in and socialize with your loved ones. They could give them their snack that has already been prepared. They can play cards with them, play music, whatever their interests are. But companions do not provide hands-on care. And both of these services do cost money. I wanted to share this graphic with you because this really says it all. Because every situation is different, dementia caregiving is not a science. It cannot be studied from books. Dementia caregiving is an art that needs to be experienced with the heart. Dementia caregivers give care daily from their hearts, no matter how tired they are. Thank you for the opportunity. We will now open it up to questions. And by the way, if you would like to participate in my study, here's my contact information, and Stacy will be sending out more information. Again, thank you so much.
All right. Well, first and foremost, what a absolutely awesome presentation. Thank you so much. We certainly value you being a part of the community and a voice for the community. So here's to you.
Thank you.
We do have a couple of questions, and I do have some as well. But first, I would just like to highlight some of the questions here, with one question being, how can we help families receive support that do not acknowledge the term Alzheimer's or dementia?
Well, we can approach it from just the person, the caregiver. First of all, it also depends on how the diagnosis was made. I've spoken to people who have dementia that have said that their diagnosis was given to them on a sticky note and they were sent away. So it's about education, explaining exactly what it means. There is that stigma about it, explaining what it means. And ultimately, the thing is that if the caregiver themselves are not taken care of, they can't take care of the person that they're caring for, no matter what the disease process is. It could be the end-stage diabetes, end-stage cancer. They need to take care of themselves to be able to take care of the other person.
Thank you. Another question that we have is, what are your suggestions on how caregivers can use their voices to impact policy change?
Awesome question. I'm in my third year, about halfway through my program, it dawned on me that I can be saying all that I want to say and doing all the research I want, but if I don't understand the policy, then it doesn't matter. We have to get with the people who make the policy, who hold the purse. So the best way you can do this is to partner with your Alzheimer's Association. There is a policy arm of the Alzheimer's Association. They write letters to your representatives. They go down to Washington. We march. So there are ways to get involved, and I'm sure Stacy will send more information about that.
I have add in addition to that question here. So I also thought, what might be some of the challenges our communities, some unique challenges that our community might face as it pertains to policy and advocacy?
The unique, I think that what happens is we're so enmeshed in caregiving that we don't think outside of that box. And I think also that we cannot let past experiences stop us from getting involved in politics. Policy is not the same as politics. You can affect policy without ever being a politician. As a matter of fact, as a caregiver, as a community member, you have a bigger voice than the one politician. So I believe it's next month. There's an event going on in Washington. So I hope that everyone here can show up and show out, and let's show them that we are strong.
Awesome. So we do have two more questions here, with the other one being, how should we get this information into the Black community and Black caregivers?
That is a very good question. So as a researcher, I know that I have to be engaged with the community. So you can't just go in there and leave your flyers and walk out. You have to get into the community. And if you're truly wanting to make change, you have to get somebody in the community that is a leader that other people will listen to, and give them the information and then let them pass it out. But you have to be engaged with the community. You just can't come in as Dr. Johnson, here, I'm going to take all this information from you and walk out the door. It doesn't work like that. They need to know that you take their interests at heart.
And then the final question that I have here, this one is actually from me. So as you were speaking, you spoke about the lack of education in the healthcare field. Are we still seeing that as prevalent as we saw in the past, or is that changing? And how does that, a lack of education for the people that are taking care of us, healthcare professionals, how does that affect our community?
Well, that's a multi-level question right there. So one of the as I'm reading the research that's out there now, I've known this personally, but I'm being validated by the research, is that we don't have enough providers who look like us. Therefore, when we're being examined and we're being tested, the way the questions are posed are quite different than the way we would pose the question. Also, we have the whole trustworthiness of healthcare providers. We don't trust healthcare providers. And then you want me to tell you that I'm stressed and that I've got mental issues going on so you can label me? Oh no. But the big thing is that we need to get more providers that look like us. And when we have people like me who look like us trying to do research, I need you to engage so that we can further our involvement in research.
That is an awesome answer. That is, I mean, multi-layered question, phenomenal answer. It's like
Thank
you already
you.
know it was coming.
Truth.
All right. Well, I did also want to mention, especially as you were talking about resources in the community, that the Alzheimer's Association, the Connecticut chapter, also does have a respite grant program that people can apply for. So if there's anyone in Connecticut listening, please, if you're going through this journey, there is a grant program, a respite grant program you can apply for. And of course, I'm sorry, go right ahead, doctor.
Oh, I
Or
was just
doctor.
gonna say, I see a comment by Vivian Tota as a hospice nurse. I totally agree with you. It's important that people talk to their family members about their wishes. Once we're getting to end stage, at that point, it's too late to now have the person who has the disease be a full participant. So as soon as the diagnosis is made, it's important that family members sit together and have that person be the driver of the discussion of what they want done. Now, having said that, we also know that in our community, to talk about end stage is something that our older adults don't want to talk about. But it's important that we keep trying until we get it all put together, because there's nothing worse than a person gets end stage and then the children are trying to make the decision.
Awesome. And for the Alzheimer's Association's programs and services, there is a 24/7 helpline, 800-272-3900, as well as the website, alz.org/CT. And I would definitely like to welcome Mrs. Mazie back on into the conversation.
Yes, thank you. This is awesome. Everything is just so good. I encourage everyone to take advantage of the information and the resources that's provided. Educate yourself and get out there, advocate for your loved one. And as a caregiver, take attention to what was said. It works. You have to put yourself sometimes first so you can be healthy to take care of your loved one. We're also looking for volunteers. I cannot end this. I know we're at time, but we're looking for volunteers. So volunteer with the association, wherever you are, so we can get into the community and help to educate, encourage, and make a difference. This is how we drive change. We have to educate ourselves so we know what we're talking about when we sit down with the doctors and everybody, so you can demand the best. I'll end with that. So the more education you have around this and what's available for you, is the better advocate that you can be. So we're looking for volunteers, and you will be educated as a volunteer. So, all right. So thanks for everything. So that's it for me, Joan. I just wanted to get those quick thoughts in.
Most definitely. And of course, to echo the wonderful Mrs. Mazie, if you are looking for a purpose or to add to what we're doing here at the association, please don't hesitate to reach out. The contact information is in the chat. And I want to also, again, acknowledge the wonderful Florence Johnson, soon to be Dr. Florence Johnson, for the work that she is doing and the time she took out to provide us with this awesome information. So thank you very much. And without further ado, we want to let you know goodbye. And thanks for joining us today on this conversation.
Thank you,
Okay,
everyone.
have a great day, everyone.